Okay, so today I'm going to be starting an IV. I'm going to wash my hands. I did look at the patient's name, I looked at their date of birth, and I looked at the allergies, and I didn't see any allergies or anything that would indicate I should not perform this IV. I'm also looking at the patient's arm. I'm looking, is it a good arm? Like, are there any scars? Any scratches, any indication to why I should not use this arm. And I'm not seeing anything, it looks perfect. So what I'm gonna do now is just feel for it. And the patient's not feeling any pain. I'm not feeling any sort of edema. So I'm thinking that this is a pretty good site. So what I'm gonna do next is I'm gonna take my kit here. I'm gonna open it up. And I first have this tourniquet. So I'm going to place this tourniquet under my patient's arm. Okay, so that's nice and tight. Now I'm going to feel for a good spot. And it looks like, I think this looks like a good vein. So I'm going to go ahead and use this one right here. So now I'm going to undo my tourniquet. I'm going to take my ChloraPrep in my package that I received. I'm going to rub it for 30 seconds using friction. Okay, so I'm going to go ahead and throw that away. So now while that dries, I'm going to actually open this up and prime my loop right away. All right, excellent. Leave that there. So I let this sit for about 10 seconds, and I'm going to go ahead and take my needle here. Open that up. That to the side. Pull this out, and with the bevel up, I'm going to go ahead, pull back on the skin, go in at about an angle here. Now I'm going to stick it in. Go ahead and stick my catheter all the way in. All right, so I'm getting great blood return. So now I'm gonna take this out. Go ahead and make sure I pull back to make sure I get blood return. And I do. So I'm just gonna flush. Excellent. Just gonna go ahead and cap this. And I'm gonna take the tape that I have, actually I'll hook this. Leave that down. Just gonna make a nice loop. And usually I would use Tegaderm, but I just have some tape here. 2 pieces of tape. It's a pretty thick piece of tape. Usually I would use about 2 pieces. Again, I would usually use Tegaderm, but I do not have any with me. Make sure that is nice and secure. Make sure I have my Tegaderm over. And that is how I would perform inserting my IV.